The huge question that's always thrown out is how do these psychedelics work? And you can just come at that from so many different angles. Now, to go down that biological path, what's happening? There's a lot going on. For example, psilocybin, which people may know as the active agent in so-called magic mushrooms, once it's circulating through your blood after you've eaten some of it, it actually converts to a related compound called psilocin, which is the thing that's actually hitting the brain receptors. And it activates a subtype of serotonin receptor. So we have lots of different types of serotonin receptors in our brain. One is called the serotonin 2A receptor. And psilocybin and the other classic psychedelics can latch onto that the same way that our serotonin latches onto these brain receptors. So psilocybin affects serotonin, but then serotonin affects the glutamate system. And then at another level, you have this massive increase in communication across these different silos in the brain. That is probably an important level of analysis that is underlying at the psychological level. Patients who have claims of insight, viewing themselves from a radically different perspective, from a different lens, and based on animal research, there also seems like there may be increased neuroplasticity in the system so that in the days following the psychedelic experience, people are more primed to learn new things. There's a greater ability to establish a new and more optimal normal state.